We have different techniques for adjusting. One of them is a drop piece adjustment. So people ask about the drop piece. How is that effective? Because you're not really hearing the pop in the joint, but the drop piece adds speed to the adjustment. So we're going to adjust the low back. So in this case, the sacrum is a little bit posterior, which means it's back a little bit. So I'm going to take this piece. The piece comes up like this, and we just push here, and it drops down. Same thing, drops down like that. So in addition, we'll do some side posture adjustments on the patient's back as well. But the whole goal is to increase spinal range of motion and decrease joint fixation, which helps the nerve firing in the low back to normalize.